Good evening. It is now week 2 of Social Work 670, and let's go over the learning resources for this week. There are 2 chapters in the text that you're asked to read, one on theoretical perspectives on grief, the second on the grief process. There are 2 required articles, one on sacred content, secular context, a generative theory of religion and spirituality for social work, and loss as a universal concept, a review of the literature to identify common aspects of loss in diverse situations. Then there is a recommended article called Grief and Loss Theory in Social Work Practice. All change involves loss, just as all losses require change. There are a number of videos for this week. The first one describes the concept of complicated grief. When is grief not considered normal, in quotes? Generally, anything beyond a couple of years where people are still showing major symptoms of the grieving process is considered a time when it's outside the bounds. Although with grief, people can experience grief and emotions at any time. This is when an individual's ability to function is diminished significantly because of the grief. So although there are no clear set timetables, this talks about when help should be sought. The second video is on cultural humility, and just as in all practice, we have to take into consideration cultural humility, cultural implications of end-of-life issues. And so this is just another opportunity for us to think about cultural humility and then apply it to the end-of-life process. And the third video is To Live Until You Die with Dr. Elizabeth Kubler-Ross. Dr. Kubler-Ross was one of the first major theorists to talk about the grief process, especially in her work with children. And she talks about the stages of grief. We know now that not everybody progresses through all stages, and sometimes people can skip a stage and then revert back to a stage. But she did put in a way for us to understand that process. There are discussion posts for this week. The first is to identify and describe a scenario from your field or work setting when you work with a client who experienced a loss, and use course material, of course, to frame your post. Prompts for this discussion post include describing the scenario. How would you categorize the identified loss? Identify the client's behavioral expression of grief. Was the client aware of their grief expression? How did their awareness impact your ability to address the loss? And describe your approach with the client. You're responding to 2 of your classmates. Your initial post is due Thursday, and your responses between Friday and Sunday. The second assignment is a reflection paper. And so we want you to understand the sensitive nature of the material discussed in the class and be able to reflect upon it using the following prompts in your paper. Discuss an element that surprised you regarding the expression of grief. Discuss what you have learned about yourself so far as a result of readings. Discuss an aspect of the grieving process that you would like to explore further, and identify a component that you would like to learn more about. Of course, this is done in APA format, APA guidelines, and this paper is due by Sunday. The next activity is a self-care activity, and I highly encourage you to take a few minutes because it's a very short video, and the title of this video is "The Shit Social Workers Say." And it's intended to give you a laugh, and you will laugh at this video because you will recognize yourself and much of our training in terms of eliciting responses from clients, giving empathetic responses, and showing that we are caring and listening to them. But there are a lot of things that we say that if somebody from the outside was looking at us, they might get a good laugh. So those are the discussions for this week. As always, if you have questions, please email me through Outlook as quickly as possible, and I look forward to viewing your assignments for this week. Have a wonderful week.